Welcome back. Now that you practice your interview skills, you learn how to deliver a safe, relevant, and effective objective assessment. I'll teach you how to be thorough, but also keep it simple and specific, because the findings from your assessment will determine the outcome measures, and you'll base your treatment plan on those outcome measures. Let's start. As usual, you just need to read the cheat sheet. You've already planned your assessment. Now you need to perform it. You always start asking for consent. It can be just a quick sentence like, and now we'll check together your joints and muscles and see what we can improve. Does it sound okay? Done. As soon as you start the assessment, you also start to talk. Maybe you thought that the interview was the moment when you had to talk the most. Objective assessment and treatment need at least as much talking as a subjective does. I'll tell you why with an example. I refer to Mary again with her hip replacement. For every item you need to assess, you need to verbalize what you're going to do. So now I'll check the movements of your hip, okay? Or now I'll check the strength of this muscle here. Then you need to verbalize how you're going to do it. So I'll put your leg up here and let me know how it feels. Or I'll try to pull your foot down from here. Try to resist against my hand. Then you need to verbalize how you share the finding and give context. Yeah, you can see you don't have much movement here, huh? That's definitely some stiffness from the surgery still. It's likely why you're having issues walking. Or maybe you can say, your muscle is nice and strong. That's great. You'll have to do this for every single item of the objective assessment you wrote on the cheat sheet, and as quickly as you can. You can take notes of the result too, if it doesn't slow you down. You follow the next items one by one, with some basic considerations about standing up and walking. You will always ask the patient to stand up, but you'll only assess the sit to stand and the walk if you're assessing a patient in a lower limb or spine scenario. If you find the patient lying on the bed, it must be an acute post-surgery case. So you cannot ask them to stand up and walk, unless you deem it safe considering the rest of the assessment. I'll give you complete information about every single factor you need to assess in the next module. Right now, we'll go through general examples about what type of sentences you need to use while you go through the objective assessment with your patient. Sit to stand. I was looking at how you stood up. You had some trouble putting weight on your right foot, right? Was it painful? Walk. Let's walk back to the bed now. I can see you're not very stable, right? You're also taking shorter steps on your right side. Did you realize? Observation can happen while the patient is standing or lying down or both. For an upper limb or neck scenario, you can comment about what you're observing while they're standing or sitting. So ask to remove their top if necessary. For a lower limb and lower back scenario, you can comment about posture while they're standing, but you will have to talk about color and swelling while they're lying down on the bed. Palpation must be very quick, as you're not expected to use a huge range of manual therapy techniques during the exam. Some soft tissue release at most. Firstly, place your hands on the area you need to assess to check the temperature. Then put very gentle pressure along the joint lines and the main muscles involved in your scenario. I'm just placing my hands on your knee. I can feel it's quite warm. If I put some pressure on this muscle, does it feel sore? Or what about along this line? When you check the contralateral, you can do it quickly and easily, as you can expect that there shouldn't be any issue. Checking the contralateral side is very important to tick many boxes in the domains and performance indicators checklist. But also, it allows you to give feedback to the patient and give you an instant idea of which final outcome measure you use. In fact, as soon as you assess the side your patient needs help with, you'll start comparing it to the normal side, and you can start getting your brain into gear for the last part of your exam. Because if you see that something can be improved, then you want to improve it. For both sides, please follow the bonus material for the objective assessment. Consider the exceptions listed in the bonus material, but in general, you need to test the contralateral in all the items listed, then the proximal and distal joints in the affected side, then finally the affected joint or muscle. Use the goniometer and the special tests only on the affected side. Please do not stop moving as you talk. As you explain, you need to stay on top of the cheat sheet schedule and already prepare yourself, your body language, and your patient for the next test. All the tests and procedures that you need to perform are entry level. You should be already across all of them. However, you'll find plenty of information on the internet to freshen your memory. You'll find different ways to perform some tests, so find the one that is more natural for you. Don't stress about finding the perfect test, just find what works for you. You need to demonstrate proper manual skill and adaptability, so you just want to look confident and organized in the sequence of your testing. You can see that I've explained the objective assessment for the musculoskeletal component only. There are obviously differences with cardiorespiratory and neurological assessment, but the framework is exactly the same. In the bonus material, you'll find the complete assessment for musculoskeletal, cardiorespiratory, and neurological exam. Remember that the bonus material for the cardiorespiratory and neurological assessment doesn't replace the framework that you've learned with this course. You only need to add and tweak the items and the information to suit these two different scenarios. The framework stays exactly the same. Your training must prepare you to go through the objective assessment with confidence. You'll also have to prepare for different protocols and scenarios where you will have to remove some parts of the objective assessment, make modifications. These will depend mainly on specific post-operative protocols and irritability. You might need to ask the patient to guide a passment movement themselves if they're guarding a lot or they're scared. You might have to change position different times if they're uncomfortable. The only way to get confident at this is to train multiple times all the scenarios that I've listed in your bonus material. Also, you might decide to skip some special tests depending on the findings of the interview and to save you some time. For example, the upper limb neural tension test if there's no radiating pain. Finally, you must know when a neurological assessment for the upper or lower limb is required. As a general rule, you don't have to do it if there's no pain radiating from the neck past the tip of the acromion, from the lower back past the buttocks line, or if no numbers or paresthesia are present. You need to be able to perform a complete neurological test in under 3 minutes. So, you know what's coming, right? Pause! Look at your cheat sheet to make sure you performed all the tests listed. This is the most important part of your objective assessment. Again, you need to summarize the findings of your assessment, explain them to your patient, relate them to their normal status and to their diagnosis, and finally, confirm the goals or establish new ones together. These goals are the result of their desire or preference, also the referrer's suggestion and your clinical expertise in evaluating the findings of the assessment. Don't rush into the treatment before this summary. This part is important to tick multiple performance indicators and set you up to an effective treatment with your patient complete collaboration and commitment. As you establish the goals, have a look at the outcome measures you wrote on the cheat sheet. Here they are again: pain 0 to 10, range of motion with the goniometer or taping measure, strength 0 to 5, walk in quality and distance, sit to stand quality and repetitions, 8, education or winning, balance and education. You can start focusing on them from this moment and select the ones you want to use that are directly related to the goals you are discussing this last time with your patient. It's homework time. You need to practice a lot. The objective assessment is definitely the part of the exam that will need the longest to prepare because it holds the basis of what you'll do from now on. You'll need to know how to measure range of motion for every joint, how to test muscle length and strength in every movement. You need to remember all the sequences by heart and all the special tests. You especially need to practice verbalizing the what, how and why of each test in a timely manner, still maintaining the flow of the assessment. So grab your bonus material, start studying and practicing. There's lots of work to do, so good luck. In this session, you learned how to use the cheat sheet to perform a precise and quick assessment. In the next module, you'll learn how to use the findings you collected from the assessment to create a perfect treatment plan, which will be effective in achieving the goals you've established with your patient. See you there.